Good afternoon, this is TTT Live. I'm Dike Rostant with a COVID-19 review. The number of confirmed COVID-19 cases in Trinidad and Tobago remains at 114. In its daily morning update, the Ministry of Health says 1,298 samples have been sent to testing to date. Of the 114 positive cases, 52 of these came from the group of nationals who recently returned from a cruise. The number of deaths due to COVID-19 remains at 8. 20 persons have been discharged from hospital. Minister of Health Terence Dialsing said that the fact that the number of COVID-19 positive cases has not changed in the last 48 hours is not a cause for complacency.
I think the public should not even be contemplating raising any victory flag. We have won nothing. The virus is there waiting to strike the minute and the day we drop our guard.
The minister made this comment when asked about increased levels of vehicular traffic noticed on the nation's roads. He went further to explain why relaxing the health measures too soon could have disastrous effects.
The plateauing of cases does not mean that the virus is not lurking in anyone around us. As the Chief Medical Officer has said, pretend that everyone has it, keep on the measures, keep on the social distancing, because all the research tells you that once a country starts to retreat from these social distancing measures and hygiene measures too soon, you get your second wave and your third wave, which can be deadlier than the first wave.
Now for a look at the effects of COVID-19 in the Caribbean region. Jamaica now has over 140 cases of COVID-19. One of those testing positive is an employee at the Ministry of Health and Wellness. This has led to the suspension of operations at the head office buildings in New Kingston today, that's Friday. In a media release, the Jamaica Health Ministry said a sanitization exercise in all of buildings will be done. Testing of other staff members and contact tracing will be conducted. The Minister, Dr. Christopher Tufton, has tested negative for the virus, but the Permanent Secretary and others have been quarantined. Over in Antigua and Barbuda, localized testing for COVID-19 will begin on the island next week. That's according to Minister of Information, Broadcasting, Telecommunications and Information Technology, Melford Nicholas. The delay in testing was due to the kits being held up in the U.S.
Has been a more recent action by the government of the United States to literally, for their own internal purposes, restrict the exportation of material goods that are necessary for public health in many other countries. And so some of the reagents and test kits that were destined for Antigua were held up. The goods are now in our hands, and through our ambassador in the United States, we would expect those goods to arrive here on Friday on Amerijet. And so we should have all of the resources that we need to fulfill our obligations for our own local testing.
To Guyana now, there are close to 60 COVID-19 confirmed cases. And although the figures continue to climb, the Minister of Health, Volda Lawrence, reported on Thursday evening that there are now 9 recoveries of the coronavirus in Guyana.
Of the 57 positive COVID-19 cases, 4 are known to have a travel history, and the other 53 persons contracted the coronavirus disease in Guyana. Our confirmed cases in region number 4 represent more than 80%, with most of those cases coming from Georgetown.
Haiti will reopen its key textile industry next week. This from Prime Minister Joseph Jout. As he suggested, the impoverished nation had escaped the worst of the global coronavirus pandemic by imposing early on a state of emergency. The poorest country in the Western Hemisphere typically struggles to fight serious disease outbreaks due to its high population density, lack of water and sanitation infrastructure, and inadequate health services. Yet so far, Haiti has only registered 41 cases and 3 deaths, compared to 3,614 cases and nearly 200 deaths in neighboring Dominican Republic. Jout said the initial term of the state of emergency expires shortly, and the government was considering whether or not to extend it. Either way, it had decided to allow the textile manufacturing sector, which accounts for 90% of exports, to restart from next Monday. Well, we've just heard some of what is happening in Jamaica. Earl Moxham, senior journalist at the RJR Communications Group, joins us on the line now to give us some more details. Greetings, Mr. Moxham. Now, the Minister of Health and Wellness, Dr. Christopher Tufton, recently confirmed 18 new cases. What more can you tell us about that?
Hi, I sort of lost the first part of your question. Can you just repeat it quickly?
I'm wondering, what more can you tell us following Dr. Chris Tufton recently confirming some new cases?
Right. Well, things are getting very serious here in Jamaica following that spate of recent confirmations. The perhaps most eye-catching of them being an employee of the Ministry of Health and Wellness, as you reported earlier. And the permanent secretary in the ministry, Dunstan Ban himself, has now had to go into isolation for 14 days, self-quarantine, which sort of brings it home in terms of the seriousness of this crisis. The head office has been closed. But what really brought things to a head for the nation and really arrested the attention of anybody who might have been doubting the seriousness of this was the confirmation of first 2, then another 31, and then 18 employees of one business outsourcing company. And that was Alarica in Portmore, which is a municipality adjoining Kingston and St. Andrew. And that resulted in the quote-unquote lockdown of the entire parish of St. Catherine, which Portmore is part of. And there are many persons expecting that there will be more drastic action in terms of halting the movement of Jamaicans so that the spread of the virus can be brought under some control.
Well, with that in mind, describe the heightened curfew measures in St. Catherine. Now, this is specifically with St. Catherine's significance in Jamaica's development and manufacturing landscape.
Right. What it means in terms of the shutdown there is that only the most essential services should still be open in terms of pharmacies, supermarkets. Those are open contingent on shuffling there in accordance with an alphabetical order, names, surnames beginning and at a certain section of the alphabet, one set for certain days, another set for other days. The approach that has been used elsewhere in the Caribbean, including Cayman Islands, for example. It has resulted in the shutting down of all the BPOs in St. Catherine. And as you mentioned, it is a prime area for many of the manufacturing plants in Jamaica. And they also have been affected. So there are serious consequences for the economy where that is concerned. But many people are of the view that you really need to take that sort of drastic action in the short term so that in the longer term you may avoid some worse situations.
How easy has it been to enforce that curfew? And I say that because St. Catherine is not small.
Yes. The police and military, they are out in numbers. And where St. Catherine is concerned, in terms of access to Kingston, it is fairly easy to control access to Kingston or from St. Catherine because there are 2 main corridors. One coming from the Spanish Town area and the rest of the rural Jamaica straight into Kingston, and then the other route through Portmore, which is controlled by the toll plaza. So if you strictly police those 2 main entry points, it is fairly straightforward as far as entry into Kingston is concerned. Of course, some of them would also, if they are desperate, could enter through the hills, through Red Hills and that area, and come down into the urban section of Kingston. But for the most part, I think that the authorities, the security forces, will be able to control most of those points. The problem they had was that this was announced on Tuesday afternoon, early evening, set to take effect the following morning. And as a consequence of that, that window of opportunity was used by many persons to make their quote-unquote escape from St. Catherine. In fact, one young lady who was one of the workers at the BPO, I think ended up all the way in Hanover at the western end of the island. So strategically, they seem to have got it wrong in some respects. Now, if they are going to be doing an island-wide shutdown, and I'm not predicting that it will happen, but if they are contemplating that, one suspects that the approach is going to have to be somewhat different. It's going to have to be a sort of a Nicodemus-type announcement.
All right, but lastly, Mr. Moxham, I want to ask if there's been an issue or issues with hand sanitizer. I ask because there was a post from the Ministry of Health and Wellness yesterday that customers have the right to ask and should be informed regarding the product being used to sanitize their hands, as well as being able to have the right to choose whether or not they should be sanitized and not barred from businesses if they refuse.
Right, so I'll answer that question quickly in two parts. Initially, after we had confirmed the first case, the first positive test on March 10, there was a run on all the pharmacies and stores that normally sell hand sanitizers. And so thereafter, a number of providers started to make hand sanitizers, those who had not been in the business of making hand sanitizers before. And so there were questions arising as to whether some of these met the normal standards for this product. And there were times when you would turn up at a store entrance and you would be asked to submit your hands to be sprayed with whatever substance was in the container, and you were not absolutely sure that this was standard hand sanitizer. And because of that, people have expressed concern that this could be a violation of their own right not to be harmed by the product that the stores are purporting to or wish to spray on their hands. And that was the context in which the minister, I think, made that comment. I believe that we have had a greater flow of standard hand sanitizers since then. And so I don't think the problem is as serious as it used to be, but the fact remains that this is a right that people still want to assert, and the minister was responding in that spirit.
RGR Group, Earl Moxham, we thank you very much for your time, and hopefully we can speak with you further down the field, but in the meantime, stay safe. Now on to some COVID-19 news further afield. The Chinese Foreign Ministry spokesman Zhao Lijian said on Friday that there has never been a cover-up of in China of the coronavirus outbreak. And Zhao told reporters that at a daily briefing that the case toll in Wuhan, where the epidemic first emerged in late 2019, was the result of a statistical verification to ensure accuracy, and that revision is a common international practice. Wuhan's health authority earlier on Thursday revised up its cumulative death toll by 50% to 3,865. Some, including U.S. President Donald Trump, have openly questioned the accuracy of China's disclosures regarding the scale of the epidemic in the country. And that's what's trending on COVID-19. Remember, you can join us for live coverage on TTT, Talk City 91.1 FM, Sweet on 100.1 FM, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID-19 updates. Thank you for joining us. On behalf of the TTT crew, I'm Dike Rostant. Bye for now.